You're watching MontyTV. I'm Jacki Karsh, joined now by Adam Kaufman. He's the CEO at Canary Health, which is a leader in digital health self-management. What is the Canary Health coaching process like?
What they get from us, and actually it comes to them from their health plan in partnership with Canary Health, is a combination of content, so that's education, really helping them reflect on what matters to them, set a goal. They then interact with a group of people like them, and there's coaches to help them on that journey. So you're going to set a goal. We're going to give you tips, we're going to give you ideas, but we're never going to tell you what to do. So you'll never get a recommendation from our coach or our platform that says, go do this. You're going to set it for yourself, and then we'll help you achieve that.
People just don't think about the possibility of I'm going to get sick, it's not going to go away, and how do I deal with that until it happens to them. So you really swoop in that kind of pivotal moment. How do you access that person at kind of a sensitive time?
When you get diagnosed, or even much later when you have a chronic condition, everyone responds a little bit differently. So some people, their first response is fear, others is leave me alone, it can't actually be happening, others is why me? And so the first thing is to figure out what emotionally resonates with them. And the way we found to do that is to help them see that they're not alone, and that there are thousands, if not hundreds of thousands of other people like them, and tell them those stories. So we connect to them about what matters to them and how they're responding to it, and then that's the first step to helping them see how they can actually change to fit that disease into their life.
You're dealing with, disease, and so when you have that kind of really sensitive subject, you have to make sure that your employees, your coaches, the people that are running these groups are well qualified to really help your patients and your clients. How are you screening those people?
We invest a huge amount in security of the platform, and then also have health professionals. Our coaches are trained, we monitor them. And the nice thing about a digital environment is we know everything that's said. So every message that goes from our coaches is through the platform itself, so we track it. We have our clinical staff who are looking into that, we follow up with them. So it hasn't been a problem yet, and we're very thankful for that.
You're partnering with some really big companies, a lot of the big health insurance companies who are a little bit unsteady in this climate. How does that affect you?
Policy really does impact healthcare, right? We're in a regulated environment, and what the government says has a big impact. We've been fortunate that what we do, whether it's sort of from a value-based standpoint or from a consumer empowerment, fits in both models. So whether it's a Democrat in the White House or a Republican, what we do is important to all of that. So we think it's really early innings. There's 130 million people in the US who have a chronic condition. And if you look at what we've done and all the players in this space, we may be engaged 1 million of them, maybe 2 million. So we're at low single-digit % penetration for an industry. So for us, it's heads down and get to half of that, all of that. So we've got a lot of people we have to impact before we have to think anywhere beyond that.
Let's hope you make some more people healthy. Thank you so much, Adam.
Thank you, appreciate it.